Round of applause for Brian.
Thank you. Okay, thank you. Good morning, everyone. A little background. My group is a consulting firm that focuses primarily on strategic growth. We do everything for consulting services for large health systems, provider groups, medical diagnostic companies, device companies, pharmaceutical companies, so on and so forth. How many people in here do we actually have from the clinical setting? Just a few. All right. So some of the things I may be saying to you are not too surprising. We've seen a significant change occur very recently with our patient bases. And having been an administrator at a healthcare system, it's very interesting to see the influence of digital technology on the patient base. And what's occurring right now is that we've got all those influences of big data, the digital devices, and they're creating a perfect storm within our patient bases. What this is doing is creating a really savvy customer that really has specific expectations around what their healthcare experience should be, all right? Just a little information for you here. So patients are consumers. And every time I say that at a hospital system, I always see the providers and the administrators cringe. But the reality is that patients are consumers. They are becoming the largest payer group to a healthcare provider. And right now, what they're saying is that they're not getting the tools and resources they need to manage their health. It's creating significant dissatisfaction, all right? And why is that occurring? Well, we've got a shift in our marketplace, and that truly is that the patient is the consumer, and they're creating an environment of consumerism. We've seen this in a lot of other industries, but healthcare is always a lagger. And so what's happening now is we've got an empowered consumer who has access to information they've never had before. They are the ones who have the dollars that are reimbursing their care. I know I have a $6,000 deductible, right? And you better expect that if I'm going into a hospital system and paying them $6,000, that I have expectations around what that experience should be. And it's not being in a semi-private room. It's not waiting 4 days to find out what my lab results are, so on and so forth, okay? So I'm going to start making decisions, and others who are also paying with their own dollars are going to really be making decisions about where to go, who to access, what services they want, dependent upon how much money they're bringing forward. So we've got this change, this evolving digital patient. What's happening here is that the shift is happening because we've got open information resources. We've got a social environment where people really are talking and sharing this information. Before, what used to happen was that I would ask my neighbor, who do I need to go to, right? I just moved into this community. I need to find a pediatrician for my son. So I would ask the neighbor over the fence, and they would tell me where to go. But now, the empowered consumer is the one who's going on and starting to do the shopping, all right? And they're looking at information resources. Now, this is really interesting because the research tells us that hospital systems and providers want to focus on quality, all right? Quality as their primary differentiation point besides being close to home. But the reality is most consumers accessing healthcare believe that if you have MD or hospital attachment, that you are already providing quality care. So what are the key points of differentiation that start to come forward that really make a difference? It's about service, it's about access, so on and so forth. All right? So the patient journey, again, now is this open information resource. And what we see is that they're influenced by all these different communication channels that are out there. And the reality is that most of those are becoming digital. We're now a 3-device society. And I would challenge that to say we're really 4. Because what we consider a 3-device society is a laptop or a desktop, a tablet, and our cell phone. I would say now you've got the influence of all the wearables that also should be considered here as well. How many people don't have an iWatch or some other wearable that they use to access and monitor their health and emails and that type of thing, right? Okay. 46% are now considered active digital adopters. And so what we want to do is start to take a look at how people utilize these technologies to access and make decisions about what healthcare providers they want to choose and how they move forward with those. Overall, health systems, and I would encourage all of you to really think about your digital presence from the standpoint. We see a lot of people talk about apps, developing an app. CEOs in particular at health systems want to say, we need an app to be out there. I want to be on iTunes. I want to be on Google Apps. But the reality is, publishers brought 100,000 apps forward in 2016, 57% increase over the year before. The reality is, we as users use 3. We use 3 apps in our daily use. You really have to think about what's the value proposition that I'm bringing forward to the customer in order to keep them engaged with that technology. So it's not an ego decision, it's really about what's the value proposition. How am I going to keep them engaged? How am I going to keep that information updated? How am I going to present the value back to them of having that information? That's also the issue with electronic health records, okay? So many of those are closed off by what consumers really want the information to do for them. So this is the reason why we don't have alignment and use like we thought we would or should have. It's because we're not really considering what the value proposition is from the customer standpoint. As we think about mobile, particularly from a decision process, 50% of consumers who do a local search, okay, on their smartphone will take action that day. That really means you need to think about the channels of that customer acquisition. So once they've utilized your device to get to you, then what's the call to action and how will I track that to really make sure that I'm getting a return on investment for putting those apps forward? So from a digital health standpoint, when we look at how consumers are utilizing the information, 72% of individuals, particularly women, are utilizing their mobile phones to do smart searches about healthcare. That's a significant increase over the year before. We know that the woman is the primary healthcare decision maker in the household from a healthcare standpoint, okay? She is the chief navigator for her family. So we want to make sure that we're connecting with her and giving her the information that she wants in that search, and that it's easy for her to take an action as a result of that. We also take a look at how people are using this information and from a demographic standpoint so that we can better understand how to create that value proposition. Another big influencer that's come forward besides just the cell phone is that in healthcare in particular, we like to create data, right? It's data for data's sake, but we're not necessarily knowing what to do with that information or how to bring that forward. So what we need to do is create a construct that identifies the need and the patient, helps to educate and personalize that experience, okay? Measure what that information is, and use that information to better engage with them going forward. That engagement will help create really a fundamental change in how we operate our businesses. So from a standpoint of what this data can provide us in helping to define that value proposition and make sure that we're continued to be engaged with the patient going forward. We've got things about attribution tracking now, how customers respond to content, so we can see what kind of information they're interested in. Device graphs, we can take a look at how individuals are using their devices and when they're using those devices and where they're going with those devices. We use that research to build profiles, and I'll talk about that a little bit more later. And then you use that information really to help you key in on what's your differentiated position in the marketplace. And that's what we're hoping to do with most of our health systems that we consult with. So understanding consumer expectations, what that data has really begun to show us is that 61% of individuals want to get appointments very quickly. And they're willing to make changes in their provider. So before, we used to have a primary care provider that we would go to for everything. Well, as consumerism emerges, okay, people want it when they want it, where they want it. And that experience has come because of other outside healthcare industry ways that we access business information, or access products and services, excuse me. So, go back here for just a second. So consumers said that they would switch providers if they could get an appointment quickly, 61%, 52% to get an appointment at a convenient location, great customer service, 51%, and 47% understand cost. Okay? I want to understand what I'm going to have to pay. How many of you have had a physician's experience fairly recently and you got a bill and you were just completely surprised because you didn't know you were going to get a bill from the x-ray department, from the hospital, and also from your provider? Payment is dysfunctional in healthcare. But there are other groups outside the industry that are doing this really well, and they're starting to set the expectations in the mind of the consumer of what I should expect. All right? The evolved patient wants convenience. 80% want to be able to make appointments online. The virtual doctor, okay, in between 2015 and 2016, 20% increase in virtual visits. I don't want to go to the urgent care and sit there with all the sick people with the screaming child who has an earache. I want to have a 15-minute visit, pay $40, and have a consultation with a provider while I sit on my couch with my child. And that's what virtual visits are allowing us to do. Consumers want digital health care, but their reference is retail. Okay? 78% of tech-savvy customers say their healthcare digital customer experience needs improvement. Mobile healthcare is perceived as lacking ease of use and features, with 62% of respondents citing it's not able to accomplish what they want to do, and that is searching for a physician specialist, accessing health records, changing and making appointments, accessing test results, paying bills, filling a prescription. Those are the key things they want to do. What's an EHR supposed to do? It's supposed to do all those things, right? An EHR is an electronic health record or an electronic medical record. But they're supposed to be delivering on this, and they're not. Somehow there's a disconnect in the value proposition of what healthcare institutions are putting forward about this electronic health record. So retail is an influencer. Retail is an influencer on how we are interacting with this consumer. 22% of healthcare consumers are using various forms of retail, including in-store and virtual. I can go to CVS, I can pop in, put my name on the screen, don't have to go through a registration process. I know that my interaction will cost me $15, $25, $40. That's what consumers are expecting going forward from a healthcare standpoint. Virtual delivery will really expand into chronic care management, making care at home and other access to healthcare in a more convenient way. I saw Conversa as a sponsor. Do we have anyone here from Conversa? All right, I'll be talking about the Conversa chatbot in just a little bit. So here is a significant competitive issue. Retail is moving into the healthcare space, and they're doing it in an effective way because they already understand the customer. Healthcare doesn't take the time really to understand the customer, whereas retail is building models of delivery around the customer and their understanding of the customer. That's why we see organizations like Amazon, CVS, and others moving into this space. We also see an avalanche of all these connected devices. You guys know what kind of things that are out there now. Everything from pet care, door locks, coffee makers. But all that information is feeding data somewhere. And what that starts to tell us gives us data about how consumers interact and use those devices, and then we have to determine if there's a healthcare opportunity for us to insert ourselves there. Voice search will completely change how hospital systems have built their websites and search on their websites. Because how I ask for a search is completely different than how I type it in on my computer. Okay? Alexa, I need to find a pediatrician in my area who can see my son today. That's completely different from how I might type that into my search engine. And what we're seeing is that over the past few years, 23% have used voice search for health-related information. %20 of all searches from a voice search will be 50% by 2020. Again, all that information is feeding into opportunities for us to really create a value proposition that personalizes the healthcare experience and delivers upon that. Well, the cartoon that's going to pop up talks about, it shows these people sitting on a couch and shows this person hanging outside their window looking. There you go. All right. Don't worry, it's only marketers collecting our personal data so they can create a more relevant advertising experience for us. Facebook just got in trouble for this, didn't they? Right? The consumer knows you're collecting information on them. So we need to be able to move forward and think about how we utilize that data to create a personalized experience that helps them improve their health, that doesn't scare them with all the information that we actually have. And I'm trying to go forward, and it's not. So, what starts to happen is that as a healthcare marketer focusing on strategic growth, okay, I can start to go out and I can gather information on you based upon demographics, based upon your clinical information, and also I start to have access to how you've purchased things. Every time you use that Kroger card, every time you use your Shell number to buy gas, I can start to pull that data information from those groups to start to create real customized profiles of what you are when you purchase and what you're purchasing. So I can start to really understand your decision-making process. This really comes forward in a really complex opportunity to create an engagement with that particular customer. And I'll give you some examples here going forward. Go ahead to the next one. There we go. So when I have access to all that data and then I start to marry that with your clinical information, what we can start to do is really influence you at key times to be a user of the information that improves your clinical performance, okay, your clinical health, as well as creates a better connection with the health system or with the provider so that there's added value there of having that relationship. So, here's an example, chatbots, okay? Conversa creates a chatbot that will help individuals better manage their health and decrease calls to the provider's office by doing custom check-ins, for instance, with the diabetes patient, to say, you get a text, hey, Sarah, it's Dr. Rand's office. What is your glucose today? Oh, one, what we've started to do is manage that patient's daily assumption of glucose monitoring, right? Two, I feed that information back in, and it says, did you take your insulin yesterday? So we start to see a process there of automated conversations that reduce the number of calls and interfaces with the provider's office, but gives them real-time access to information and also know that you're concerned about their clinical care. So all this information is starting to be powered by artificial intelligence. What's interesting is that other industries are using AI, but healthcare is scared, completely scared of it. Why? Because the providers have always been the ones who have had that intelligence, right? They're not understanding how you take and leverage artificial intelligence to really help offset workload and other things that can create value to them and their patient base. So, 80% of business-to-business marketers predict AI will revolutionize the marketing operation by 2020, but only 10% of it are actually starting to use that in their business practices. There's a big opportunity for you out there as digital thinkers in this space. By having opportunities to help individuals influence their health in this pathway, okay, what we're leveraging really are those micro moments. And I'm not sure if you all have seen the article from Google about micro moments, but if you haven't, you really should, okay? It's talking about how you create value across the continuum in your digital experience. It's 3 points. By being there for the consumer, the customer, the patient, by being useful, again, that value proposition, right? And being quick. So that meets and marries the expectations of the consumer from a retail experience standpoint, but puts that forward in the auspices of the healthcare environment. Okay, here's an example, and I'm just going to go through some quick examples for you of some organizations that are really doing this well. Ochsner Healthcare. You guys familiar with Ochsner? Okay, Ochsner's out of Louisiana, and they have some Alabama representation as well. Ochsner has taken the digital engagement component piece of the patient experience and really thought about how do I manage that into clinical care delivery, and how do I create an empowered customer who's willing to interact with us in a digital space. First concept is I've got to teach people how to do that, okay? So they took a retail model. What does this look like? The Apple Store. This is in their lobby at their hospital system in New Orleans. This is the O-Bar, where I can go up to with my prescription from my doctor and learn how to use a glucose monitor and how it interacts with my phone and how to track that information. So they've created a digital opportunity to manage chronic care through chat box, wearables, and other forms of interaction that creates value and teaches the patient how to utilize that information so it's not scary. It's very approachable from that standpoint. This information connects to their EHR, and they're one of the first hospital systems to do this. So now no longer do I have a provider who just orders a lab test for sleep apnea that considers one night, but gives them data across all the nights, right? So they can really understand and track trends and resources and things along that line. The reality is the digital patient is now, okay? We've got wearable devices, again, interacting with electronic health records. We've got consumers using devices and apps with partners for like Uber, who is creating an opportunity for MedStar patients to actually show up for their appointment, okay, by utilizing those apps. We've got HealthTap and others that are using voice-driven skills to assess symptoms. Evergreen Health uses Alexa with their OB patient population to help patients, initially those parents, understand some of the basics once they've had the baby. Things that are common questions like, Alexa, when's the umbilical cord supposed to fall off? Or Alexa, I need help nursing my baby. And they can send you to lactation resources, things along that line, right? Okay. Insurance providers are now offering reimbursement for virtual visits. My insurance provider has even opted into a partnership so that they actually get some of that dollars by managing how you use virtual visits. Chatbots are being used by Ochsner. I mentioned Conversa. Conversa's partnering with Ochsner to do the chatbots to manage diabetes patients, and they've seen significantly great outcomes there. And we've created all these different data sources that are coming forward that really help us to understand how patients utilize digital devices to interact with our organization and to manage their care. So, it's a scary fact for providers and for health systems to think about this. But the reality is about 85% of our healthcare interactions don't need to be hands-on. And they can be managed through digital applications. So we really need to think about how we bring that forward from that standpoint. So I hope that what I've done today is help you understand a little bit more of how you might engage or how you might consider the value proposition of how you engage with patients and customers in order to bring more strategic growth to your organizations.
Thank you. Does anyone have questions for Brian? Wonderful.
Yep. Go.
Just a question about the chatbot. I'm just trying to understand the mechanics of that. There's not a real person on the other end. It's just a decision tree of answers to questions, and it goes through a script.
That is correct. And essentially what it does is providers have within most patient constructs a clinical pathway that they're following. And what the chatbot does is help to do basic initial assessments in order to make that individual feel supported and that, one, the provider cares about them, two, that they actually are doing what they need to do to manage their chronic condition, and three, to help them understand if the patient is not compliant, what do we need to do? So for instance, if it said, if I responded, I didn't take my insulin yesterday, what I might get as a response is, Becky from our office will be calling you today to understand what the issue is. And what we might find out is, it hurt my stomach, so I'm not taking it. I couldn't afford it. I couldn't get to the drugstore to pick it up. And so we understand what those influencers are. And some of those we can help manage from a provider's office, right? It could be that my prescription ran out. And what I don't know is that I could just say, I need another refill for this particular. So it manages some basic construct there, and if there's a clinical interaction that needs to occur or an actual conversation, then it prompts that conversation. Yeah. Yeah.
Thank you. Wonderful talk.
Yeah,
Some sort of really innovative thoughts. One question, one comment. The question is, you present a lot of data. A lot of the data is actually very tough to come by when it comes to wearable data, especially. I'm curious, do you have data on wearable uptake by demographic and the different types of technologies? Have you come across that? Do you know where to find that? Because it is very difficult to come across.
Yeah, it's really difficult to come across right now. And I believe part of that is that we don't quite have the complete open architecture that we should have. For instance, and this just goes to the further dysfunction of healthcare, right? You may have a wearable, but your EHR may not allow you to interface that wearable with it. So you've lost a data connection there. Or you may have a wearable that interfaces with your EHR for your local provider, right, that you're seeing. Well, that provider may not have an HIE that connects it to all the other providers that actually create continued value. HIE is a health information exchange, if you don't know what that is. And what that's supposed to do is take all the various disparate EHRs and allow them to cross-talk and cross-populate information. And then that information, if it is present, isn't necessarily getting to all the people that it needs to because we haven't built the systems to pull that data back. So there is some information out there. I don't know that it's any more that you don't already have access to. But that's basically because of a lot of dysfunction from that standpoint of, again, retail would build the system up, right? What we're trying to do is take a built system and insert a new property into it and then consider from that device what can we pull and how can we use that information rather than starting with the value proposition at the beginning that says, what do we want from that device and what do we need to build in order to get that information? Does that make sense? Okay.
When are apps going to be able to perform surgery? I say that
Yeah.
just rhetorically.
One more question because we're out of time here.
Sure. So when you say that the EHR won't allow the apps to import the data into them, I'm at a provider and I have a little bit different perspective on that. We haven't had problem importing the data into the EHR. One of the things that we find challenging is that the apps have proprietary data transmission mechanisms.
Okay.
They have proprietary interfaces. They don't have an open platform, so they want to own the UI with the patient, which leads to an extremely disjointed and fragmented experience across the marketplace, leading to a million different workflows, which is why you need something like the auctioneer OBAR.
Right.
So the manufacturer, the device manufacturer industry, the app developers, all of those folks need to open up their platforms. Getting the data into the EHR is not the problem.
It may not be at your organization. at a lot of organizations, they are continuing to struggle with how to get that data in and how to manage the data. So respectfully, at your organization, that may be fine. Yes, you're exactly right. From a device standpoint, there are a lot of doors that you would have to go through, a lot of partnerships that you would need to develop in order to make sure you have access to that information, right? But let's think about it from the consumer's perspective, okay? I bought the Fitbit, and I bought this one because it's supposed to interact with my EHR so that my doctor can help me manage my diabetes and see that I'm walking and that I'm getting out there and that so on and so forth, okay? So what we've done is we've created within our space, because we haven't developed those partnerships and being able to access that information, we've got a consumer who says, I just paid all this money to be able to use this information, and it's my health system locally who can't make it work, right? And so there we have a value proposition that's not in line with actually what the deliverable can do. So those organizations, those health system organizations that have an innovations group or that have the knowledge and the desire to go out there to really think about how these devices can be used going forward and improve healthcare and reduce the amount of time that providers have to spend with the individual and managing chronic conditions, those are the ones that are really going to come forward with a distinct product and a distinct consumer interaction that's really going to make a difference. I would just mention, if you haven't, and if you don't, follow Eric Topol. He is a physician that is out of the California market, who I believe writes for the Wall Street Journal and a few others. And he is all about how you take your digital device and how you use that device to improve your health care and eliminate cost, redundancy, all these things from a provider and a health system standpoint. And he's saying, for instance, you can take your cell phone and he can do EKG testing and all with his cell phone, and it's the same test. He's compared the two tests side by side. They're the same test as what he would get from his provider that would cost whatever all the infrastructure and systems and all would cause that expense to be. So he's really got some good ideas on how you take these digital devices and really use them to make a difference.
Thank
Thank you guys very much.
Thank you. Please give a round of applause for Brian Whitman.